You might feel like all your progress in the gym is going to shit when you have a pain flare up, but I'm here to tell you that flare ups are actually a normal part of the rehab process, and sometimes they're even something that we want to have happen. Flare ups are not necessarily bad, and they also don't necessarily mean that you're losing progress in your rehab. And it makes sense that you probably think this because a lot of doctors just kind of cover their ass when it comes to pain and tell you to avoid anything that involves pain. And it kind of gives you the idea that pain is this bad thing that we want to avoid at all costs. And of course, it also doesn't feel the best. So that's another contribution to this whole mindset. If you have a flare up, you might just rest the rest of the week. You might never go back to squats again for like another couple months because you're scared that it's just going to ruin all your progress with your pain. You might even feel like you have to start from the very beginning of your rehab process, which I totally understand, but I'm going to show you how to differentiate a actual regression in your training from just a flare-up and how we can navigate that. So by the end of this video, you're going to understand what a normal flare-up looks like, how to tell the difference between your body giving you a warning sign to stop and it just being a normal reaction to your training, and exactly what framework to use to know how to move forward from one instead of just guessing and pulling it out of your ass. Hey, I'm Dr. K. I'm a physical therapist and a strength coach, and I help women who want to feel fit and strong in the gym, get through pain, get back to the bar so they can feel like a badass in the rest of their life again. If that sounds like your vibe, go ahead and subscribe and stick around for more. So we're going to talk about what a flare-up actually is, first of all. So throughout the rehab process, and kind of like with just lifting in general, you're bound to have a flare-up. And a flare-up means that your symptoms are super irritated today, your back hurts more than usual, your knee feels really achy, you were doing great, and then all of a sudden, boom, your pain comes back. It may even feel just as bad as it did when you first started, and it can just be really frustrating because the whole point is to get out of pain, and you feel like you're making progress, and then all of a sudden, it just comes back with a vengeance, and you're like, what the fuck? So, and this is basically your body's reaction to something that's changed in your environment, something that's unfamiliar, unprepared for, or just like kind of coming out of nowhere. So flare-ups usually are not totally random. There's usually a reason why they happen, and it's important to kind of like sit down and figure out why this might have come up in the first place, or have a coach talk you through it and you can find it out together. So a lot of the most common things that I see when people do have a flare-up is they're returning to a previously irritating movement pattern that they haven't done in a while. They've bumped up their volume in the gym a bunch, like they just loaded up the bar a little bit more than usual. And the third most common has nothing to do with the gym and everything to do with the rest of your life. So if you've had like a super stressful week at work, or you're not getting a lot of sleep, or you forgot your emotional support water bottle at home and you're not really staying hydrated, those things can all come together or separately, and create this flare-up response in your body. Your body is just really sensitive, and it's letting you know that it's not used to this situation. It's not really comfortable with it, and it needs a little bit more time to acclimate. So while it can mean that you're doing something a little bit past what your body is used to doing, it's kind of a good thing because you're able to at least attempt it, which is big, and you're able to just like work up to that like limit from where you started. So the fact that you're able to even make a little bit of progress from totally zero to like a little bit higher than zero is good. You're doing the thing. The problem is that your body isn't very used to it, but we can solve this problem. Because the flare-up has given you information about where your body's upper limit is at right now, we can use that to taper it down a little bit, not all the way back down to zero, but a little bit, maybe take 10% off. And we dip a toe into the water at 10% less than what you were doing if we're talking about a weight. So say 100 pounds on your back squat was like, nope, no thank you. Okay, so we have information. It's not the end of the world. We're gonna take 10% off. We'll do 90 pounds. We'll see how that feels. Go nice and slow. Again, easing into it, thinking about like dipping a toe into the water literally is what we're doing here. If that's still not cool, then okay, well, forget about that for now. We'll do an alternative exercise, but we still have that information going forward next time, which is valuable. And I get that this is frustrating because I had the same thing going on with this shoulder. It was very annoyed at me. I wanted to lift overhead because I want to get big shoulders. I'm working on it with my muscle T. But I was like literally only able to do 25 pounds, and that's a little bit light for me. And I was very frustrated because anything over 25 pounds, my shoulder was like, nope. And I'm like, well, this is annoying. Like, I can't press overhead. Like, you know, when it's you, you just get in your head about it pretty much. So luckily I have a coach, and we were able to pull the weight down, change the pattern. So instead of going straight overhead, we were going a little bit forward at an angle. Basically same idea. We're dipping a toe in. We're seeing where the upper limit is. For me, it was overhead with 25 pounds. So we wanted to go a little bit at more of an angle with a little bit less weight and try that. And that's fine. The point is that you're still able to lift. You're still able to move. We're not irritating the tissue. We're not pushing that flare up even further along. We're acknowledging it, we're figuring out why it happened, and we're working around it. So this is why flare-ups are a normal part of training, and they're actually really beneficial because we know exactly where your ceiling is right now. We know exactly, well, hopefully we know exactly what caused it, or we can figure out, hypothesize what caused it, and we can edit those variables in a way that's still tolerable for you so you can still lift while respecting the limit right now. We basically want to think of your body's pain system, so to speak, as like a smoke alarm. So if you like to cook and you live in an apartment with no ventilation and a shitty smoke detector system, just hypothetically, then your smoke detector is probably going to go off when there's no fire going on. But it's doing its job. It's like scanning the area. It's checking just in case there's some sort of danger, right? It's going to go off so that you can be aware. You can check the area. You can open your screen door and fan out the apartment. Again, totally hypothetical situation. And you can get rid of that alarm. So it's kind of the same thing in the body, really, because when you're doing these things in the gym, when it's very controlled environment, you're not like doing burpee backflips or something, it's not creating any damage, likely. But what it is doing is triggering your body's smoke alarm. So your body's like, whoa, what's this? This is a little intense. We're not used to this. This might be dangerous. I'm not sure. And we are paying attention now. That's what the smoke alarm is having us do. So you kind of want to think of it like that because it's not necessarily like, you tore something in that moment. Like, sometimes that happens, but it's likely not if it's not a traumatic event. And when you're in the rehab process, when you are, dialing things down for a while to heal and then starting to bump up the volume to get back to where you were before, you technically are doing things that are a little bit out of your body's comfort zone because it's been a while. We're working on previously irritated or potentially damaged tissue, and your body is super on a high alert. So it's definitely bound to happen at some point. But again, as long as we are being cognizant of what's causing these flare-ups, figuring out how to dial it back and how to stay there for a while to allow your body to then be cool with it, we can eventually make some more progress and push up that ceiling of where you might get another flare-up in the future. So now I want to show you how to know if the flare-up is actually something to really be worried about or if you just need to chill for a minute and it'll be fine. So in the absence of any red flag symptoms such as numbness, tingling down both of your arms, both of your legs, it's called saddle paresthesia. It's like a numbness, tingling, weird sensation in your saddle area. Any weakness, like super weakness, like you can't really move your arm that easily anymore, change in like your bowel and bladder function, anything like that, those are considered red flags. And in that case, I would say probably you should go see somebody. This is non-medical advice, but just like in general, those things are not something I would generally recommend somebody to push through and be okay with. And also then in the absence of any trauma, like getting into a car accident, falling from a high height, or like doing an aggressive lift, and you hear something pop and there's a lot of pain that doesn't really subside after a couple hours, couple days, something like that. If that didn't happen, and if the red flags are not there, generally you're probably okay to keep going with what you've been doing. It's just that you have to reassess where you're at and revisit what I mentioned before about pulling down your intensity a little bit and seeing how that feels on your body instead of where you were at when the flare-up happened. And just something I want to note here is that I'm saying that flare-ups are a good thing because it's pretty common in regular physical therapy land to avoid flare-ups at all costs, to just stick to like the little weenie exercises on the table. And it's likely that you might not ever experience a flare-up if you're going to traditional PT, but then the moment you get back to lifting a bar, going to the gym, or if you're in a more performance-based rehab setting, like what I do with my clients, it's a little bit more likely that you're going to have a flare-up. But again, this is really good actually, because it means that we are pushing your limits. Like in the gym, you have to push it a little bit to see where your threshold is at, to know where your potential is. And if you're constantly living below that potential, you're not going to make good adaptations. You're not going to get fit and strong like you want to. And you might just be stuck in PT limbo, which really sucks, because then you're just doing little clams and bridges forever and ever and never lifting heavy shit. And it doesn't mean that you're failing. It doesn't mean that you're fragile. In fact, it's quite the opposite, because we're, again, pushing that envelope. It means that you are gonna be getting stronger, because now we know where your limit is. We know exactly how to pull back from there, and we know how to progress in a way that your body will tolerate over time, that will allow it to continue to get fitter and stronger. And this will allow you to adjust your training instead of completely abandoning it altogether. And hopefully you feel like you can make a little bit better decisions. If you do experience a flare-up, you know how to navigate it, how to assess it, and where to go from there. If you are dealing with this right now and you feel like you want some help, that's exactly what I do with my clients. So if you're interested, I have a link to book a free discovery call down below just to talk about what you're going through, or you can drop me a comment too, and I can give you a little piece of advice. I'm a physical therapist, but I'm not your physical therapist. So understanding why flare-ups happen is the first step. And step number 2 would then be to know how to modify your training in order to deal with this flare-up. And that's exactly what I talk about in this video, about how to modify your squats if that's when you experience flare-ups. You can probably figure out a couple things to do from this video. And if I don't see you over there, I'll see you next week. And thank you for being here. Bye.